Altered sensation in the hand is a frequent symptom that I see people for consultations. Altered sensation can affect how you perceive pain or temperature or light touch in the hand. I'm Sanjay Miranda of Hand Surgery Clinic. I will talk in some detail about altered sensation today. So common symptoms of altered sensation, how it can manifest, can be because of numbness or tingling, sometimes referred to as pins and needles, a burning sensation, or a hypersensitivity, overly sensitive touch or to pressure or to even temperature. And sometimes this is associated with weakness in the hand. Altered sensation can be for many causes, from something that's temporary to something that can actually be very long lasting and perhaps even serious as well. So the most common condition causing altered sensation in the hand is, of course, nerve compression or nerve entrapment, a typical condition being carpal tunnel syndrome, where the nerve is entrapped in the wrist here. This can cause tingling and numbness in the hand, disturbance of sleep. You've all experienced some time when you've sat on your leg on the ground and then you stand up and the leg's all numb and tingly. That's because the nerve has been under pressure while your leg has been folded under you, or if you're lying with your elbow bent for a long time if you're sleeping, or with your arm behind you. So this is all because of nerve problems. Now, in those conditions where you've been lying on your leg or lying on your arm, as soon as you straighten out or change posture, within seconds to minutes, the feeling comes back. So that's not a nerve injury. But in conditions where, despite altering position or changing or moving your arm, the tingling persists, then the likelihood is there is actually nerve pressure somewhere from the hand right up to as far as the neck. Another cause that can cause tingling in the hand and upper limb is circulation problems. This can affect the main arteries. Arteries are the vessels supplying blood to the limb, or right down to the tiny vessels within the fingertips themselves. So tiny or small vessel disease is known as microvascular disease, and this can be affected by conditions like diabetes or Raynaud's disease. With Raynaud's disease, the white finger problem can last a few seconds to some minutes. Large blood vessel or arterial narrowing can in fact affect the circulation to the whole limb, and this can result in tingling amongst other symptoms such as skin problems and skin necrosis or skin gangrene, which is commonly what it's known as. A fracture or a broken bone or a joint dislocation can put a stretch or even pressure on a nerve, resulting in tingling and or numbness of the fingers itself. Systemic conditions can also cause altered feeling in the hand and upper limb. What is a systemic condition? So a systemic condition is something that affects the whole body. So it's a disease that has effect on many different organs, including the nerves and circulation. So an example is diabetes. Diabetes is a disease where the body's blood sugar is not well controlled, and blood sugar can frequently run very high, sometimes very low too. But with this persistent, very high blood sugar levels, it can affect the small vessels and small blood vessels, and also affect the nerve, therefore resulting in altered feeling, in addition to its damage on other organs. Another systemic disease is rheumatoid disease. This is a disease usually affecting the joints and tendons and ligaments, but this too can also result in altered feeling in the hands and upper extremity by its effects on the nerves and the circulation, and sometimes due to swelling of the tendons, which causes pressure on nerves in the wrist or the elbow. Other types of systemic conditions are neuropathies. Now, neuropathy can be as a consequence of diabetes. Now, neuropathy means basically an abnormal nerve function. So that can be as a result of some disease. Diabetes affects the nerves through its effect on small vessel circulation, but also directly its effect on damaging the nerve. Then there are hereditary conditions. Hereditary is a condition which is passed down through families, which can then cause widespread effects on all sorts of nerve functions throughout the body. These two can affect altered feeling in the hands, perhaps even in the feet as well. Deficiencies or lack of certain vitamins and minerals, typically B12, folate, calcium, magnesium, all of these have an effect on nerve function and therefore can result in altered feeling, altered sensation or numbness in the hands and upper extremity. exposure to toxins. Now, this might be through industrial or things around, the home, accidentally excessive repeated exposure, or of course, should we say illicit drug use as well. This too can affect nerve function. Certain medications, typically chemotherapy, can cause loss of feeling or alteration of sensation in the hands and feet. So, where does one begin in terms of a diagnosis? Well, firstly, the healthcare professional seeing you will get a good history about your medical history, excuse me, your background, how your symptoms have come on, how long they last, how they manifest in your hands, whether they're there all the time or whether they come and go. And is there any particular time of day that this seems to bring on the symptoms? In addition to the history, the health professional will also examine you. He or she will assess for nerve function, circulation, movement, and do a thorough exam, or they should do a thorough examination with this. Sometimes specialized tests may be required, such as blood tests, perhaps to detect toxins, or to test for diabetes or thyroid function or vitamin B12 deficiencies. Occasionally x-rays may be required if there's an injury, if it's suspected broken bone or a dislocation. So what are the treatments? Well, the treatments would totally depend, of course, on what the diagnosis is. And the treatments can range from something not surgical to medications to occasionally surgical treatment as well. So your altered sensation or abnormal sensation, don't let it steal the quality of your life. Don't delay and seek healthcare advice from someone who understands hand and upper limb conditions. I wish you well.